lecture for today is Chapter 39, Assisting in Reproductive and Urinary Specialty. The woman's normal cycle of preparation for conception each month is known as menstruation. And the beginning of menstruation is called menarche, which begins when a young girl is in the age group of 10 to 15. Each month, the lining of the uterus is hormonally stimulated to produce an environment which will allow a fertilized egg to implant and develop. So, if you are working with OBGYN, you will need to know some medical terms. You will have to assist your patient as well as the provider to perform the procedures. So, let's talk about the basic things like we started with the menstruation, menarche. Now, when fertilization does not take place, the lining of the uterus sloughs off and is shed in vaginal bleeding. When a woman is no longer considered to be in childbearing years, the process ceases over a time known as menopause. And during this time, 1 to 2 years before the actual menopause happens, this is the period called premenopause, when the menstrual period becomes irregular. And during the perimenopausal time, there will be hot flashes, vaginal dryness, caused by changing levels of hormones, including estrogen. Gynecologic exam often includes question about the timing of the last menstrual period and requires screening exams including cervical cytology, chlamydia, gonorrhea, HIV. Our role as a medical assistant is to help the patient, and that is similar to that of general physical exam. We may have to ask the patient to get some urine sample. I want to share a video at this point so that you will know what to expect if you are working with OBGYN. So let's watch it.
Your role assisting with a gynecological exam is similar to that for a general exam. But a gynecological physical exam is more than just an internal pelvic exam. It is an evaluation of the patient's total health and a review of factors that could be an indicator of possible cancer or STDs. Gather the equipment and make sure all items are in working order. Along with an examining table with stirrups, you will need a gown and drape, exam gloves, and laboratory requisition. Vaginal speculum, specimen collection equipment, including cervical brush, cervical broom, and/or scraper, cotton-tipped applicator, potassium hydroxide solution, tissues, water-soluble lubricant, exam light, microscopic slides, thin layer collection vial, fixative, and a pen or pencil for notes. Correctly label the slide and/or the collection vials to avoid confusing one patient's sample with another. Identify the patient and explain the procedure. The patient should remove all clothing, including underwear, and put the gown on with the opening in the front. Ask the patient to sit on the edge of the examining table with the drape until the physician arrives. When the physician is ready, have the patient place her feet into the stirrups and move her buttocks to the edge of the table. This is the lithotomy position. Provide the physician with an exam lamp and gloves as he examines the genitalia by inspection and by palpation. Pass the speculum to the physician. To increase patient comfort, you may run the speculum under warm water before handing it to the physician. Water-based lubricant is not recommended prior to the pap smear because it may interfere with the test results. For the pap smear, be prepared to pass a cotton-tipped applicator and cervical brush, broom, or scraper for the collection of the specimens. Have the labeled slide or vial available for the physician to place the specimen on the slide. 2 or more slides or collection vials may be needed, depending on the physician, the method of collection, and the method of preparation. Based on where the specimen was collected, the slide or vial may be labeled E for endocervical, V for vaginal, and C for cervical. Once the specimen is on the slide, a cytology fixative must be applied immediately. A fixative is necessary and should be applied according to the manufacturer's instructions. Allow the slide to dry completely. This fixative holds the cells in place until a microscopic exam is performed. Cells collected for thin layer preparation should be washed into the collection vial and transported to an outside lab for processing and analysis. After the physician removes the speculum, a digital exam is performed to check the position of the internal organs. Provide the physician with lubricant as needed. Upon completion of the exam, help the patient switch from the lithotomy position to a supine or sitting position. Provide tissues or moist wipes for the patient to remove the lubricant and ask the patient to get dressed. Assist as necessary or provide for privacy. Explain the procedure for communicating the laboratory results. After the patient has left, don gloves and clean the exam room and equipment. Dispose of the specimen collection devices and other contaminated waste in a biohazardous waste container. Store the supplies, straighten the room, and discard the used exam paper on the table. Prepare the laboratory requisition slip and place it and the specimen in the proper place for transport to an outside laboratory. Remove your gloves and wash your hands.
Okay, so by watching this video, now we know what to expect and what is our responsibility working in that place. So let's go to the lecture again, chapter 39. Few more things we want to add here beyond this video, that we need to know some skills. You have to know what are the things to be completed here. Now, the medical assistant may be asked to be present if the licensed practitioner is male and a chaperone is needed to preserve the integrity of the provider. Licensed practitioner will be doing the physical exam, but also expands on the initial interview by asking further questions about factors that could be an indication of possible cancer or sexually transmitted infection. For the breast exam, the screening exam mammogram is optional between age 40 to 45, but recommendation is that between age 45 to 54, yearly mammograms should be done. After that, at age 55, women are given the option of continuing yearly mammogram or having one every other year. For the breast self-examination, uh, that is also a recommendation. Every woman at age 20 should know how to examine her own breast monthly so that any kind of unusual things that can be detected and treated, because this is an important thing to prevent breast cancer consequences. In this slide, you see the pelvic exam is being done using a speculum. One of the important tests here is the pap test. or pap smear. After inspection done by the speculum, your provider will collect some specimen from around the cervix, which will be placed on a slide to see if there is any cancerous or precancerous um, conditions prevailing around the cervix. Cervical cancer is caused by a virus, HPV. It's a sexually transmitted infection. For the wet mount test, uh, we can find whether it is the infection like you see here caused by bacteria, yeast, or trichomoniasis. We use a saline drop, and under microscope in office we can find out those diseases. So these are some gynecologic procedures. Let's go to the OB, obstetric patients. Pregnant patients will be visiting your office for prenatal care, which is encouraged to provide assessment for nutrition, exercise, medical monitoring, and childbirth cases. This is the list of routine tests: CBC, Rh antibody, blood type, pap smear, urinalysis, and hematocrit, which is the percentage of red blood cell. Patient will be scheduled for monthly visits with the licensed practitioner through the second trimester and every other week during the third trimester up to 36 weeks gestation. After 36 weeks, the patient is seen until delivery weekly. And during these visits, licensed practitioner will monitor blood pressure, weight changes, and urinary results. One of the significant conditions I want to discuss here is the preeclampsia. In this condition, there will be signs and that you can easily remember with the word pre. P for proteinuria, R for rising blood pressure, and E for edema. So there are many other signs and symptoms, but these three will be uh, significant for us to know the condition about preeclampsia. Also, gestational diabetes is another condition when the mother is having uh, diabetes while she is pregnant. When contractions or loss of amniotic fluid signal the beginning of labor, patient will be instructed to go to hospital for delivery of the patient. If labor does not begin spontaneously, patient may be admitted and given medication to start uterine contraction with the process called induction. When vaginal birth is not possible, we go for C-section or cesarean section. That helps to deliver the baby. Although rare, a medical assistant may need to assist with an in-office emergency delivery. Colostrum is the first milk, and that is very much nutritious for the newborn baby. It contains antibodies to provide passive natural immunity to the baby. Bottle feeding is an acceptable alternative with formulas available that are milk or soy-based. Mothers may choose to use a breast pump and feed this milk to the baby with a bottle for reasons of convenience or to more accurate measure intake. After the delivery, first 6 weeks of their life, that's called postpartum period, when the uterus shrinks back to pre-pregnancy size. And this shrinking can be noted as uncomfortable contractions for the first few days following delivery. Other muscles of the body which were used during labor process may be uncomfortable for first 3 days. There may be difficulty with urination and bowel movement. For 6 weeks, this bleeding, some discharge we expect there. This is called lochia. Initially, it is the lochia rubra, the red discharge, which is present intermittently. One second. Just 1 second. Sorry for the interruption. Now, we are talking about the lochia. The discharge happens after the baby is delivered. If an episiotomy was required or a vaginal tear happened, healing of this area will be needed. Emotional stress can be greater in the postpartum time period with hormonal fluctuations and adjustment needed to the routine of caring for a new person in the family structure. Pregnancy test can be done with a blood specimen or with the first urine of morning. Because over-the-counter testing may not be accurate, this test is repeated in the medical office. Testing for sexually transmitted infection can be done by taking bacterial and tissue cultures, examining lesions, ordering blood tests, and discussing sexual history with the patient. In this picture, you see on the right side, this patient is having the procedure mammogram, right? So I want to share a quick video with you about the breast cancer. I know that you know a lot of the information about this, but uh, this will be much more, I believe, informative. So let's watch this short video and then we'll come back to this part to resume the lecture.
The mammary glands lie inside the breast over the pectoralis major muscle. Surrounded by adipose and connective tissue, the mammary gland is composed of groups of lobules that form lobes, which drain through lactiferous ducts to the nipple. Epithelial cells line the lactiferous ducts and lobules. Each lobule is composed of several small sacs called acini. During pregnancy, specialized secretory cells develop in the acini and after birth secrete milk. Lymph nodes and vessels surround the breast radially and drain to axillary lymphatics. Like all cancers, breast cancer begins with cell DNA damage. Most breast cancers form in duct epithelial cells. The more these cells grow, the greater chance for DNA damage to occur. A cell with damaged DNA exhibits uncontrolled growth. This mass of cells is a developing breast cancer tumor. The stimulus for breast tissue growth is estrogen, produced by the ovaries during a woman's reproductive years. Therefore, the longer the time between puberty and menopause, the greater the chance for developing breast cancer. Some breast cancers come from inherited DNA changes or mutations. For example, the genes BRCA1 and BRCA2 normally keep cancer cells from forming by repairing or destroying cells with damaged DNA. Mutations to these genes allow damaged cells to live and continue proliferating, resulting in the formation of cancerous tumors. As tumors invade the surrounding tissue, cells may break off into a lymphatic vessel. Displaced tumor cells travel through the lymphatics and become metastatic tumors elsewhere. Other risk factors for breast cancer include hormone use or exposure and composition of breast tissue. While rare, it is important to note that men can also get breast cancer. Primary treatment for breast cancer depends on the size of the tumor, lymph node involvement, and metastasis. Generally, breast-conserving lumpectomy procedures remove single tumors less than 5 centimeters with no invasion of the chest wall. For larger tumors or multiple tumors with no chest wall invasion, the usual treatment is modified radical mastectomy. In this procedure, all of the breast tissue, including breast and axillary lymph nodes, are removed. With larger tumors and chest wall invasion, a radical mastectomy removes the entire breast, lymphatics, and chest wall muscles. Radiation therapy reduces the risk of cancer cells recurring postoperatively. Chemotherapy uses a combination of drugs to destroy cancer cells.
Okay, so that was informative about breast cancer. Now, let's move on to the next part of this lecture. We are discussing chapter 39. Right now, we are here at this point. Few more things that we can see here. The radiologic test, one of the, this one is the hysterosalpingography. As you can see in the lower part of the slide, this dye is inserted, and we can take the picture and see those structures. Hystero means the uterus, salpingo is the fallopian tube. So that is the X-ray exam of uterine tube with the use of a contrast materials such as air or dye. Fetal screening, the unborn baby screening is done to detect birth defects such as Down syndrome and spina bifida. One of the important tests is AFP, alpha fetoprotein, produced by the fetus and passed to the mother's bloodstream. 3 tests are done together here. The triple screen blood test, that is for AFP, human chorionic gonadotropin, HCG, and estriol to detect neural tube defects. Ultrasound is routinely performed on pregnant women to determine fetal size and position, but can also be identifying other abnormalities or be used to guide amniocentesis or chorionic villus sampling. Regarding the amniocentesis, look at this picture on the right side. You see that a small amount of amniotic fluid is removed from the amniotic cavity. That fluid, it's important because we can detect genetic or metabolic defects. Chorionic villus sampling may be ordered with a history of genetic disorders. Your provider can perform this procedure colposcopy with an instrument called colposcope that examines vagina, cervix, looking for abnormal cells. And if there is anything, biopsy should be taken, send it to the lab to confirm cancerous cells. This procedure is the DNC, dilation and curettage, which consists of widening the opening of the cervix and scraping the uterine lining by using curette. This is usually done for biopsy, performing an abortion, and completing an incomplete miscarriage. Hysterectomy is the surgical removal of uterus. Laparoscopy is done with an instrument called laparoscope to view internal female organs. In loop electrosurgical excision procedure, LEEP, it uses a thin wire loop electrode attached to the speculum and cut away abnormal cervical tissue during a pap smear. In cryosurgery, freezing the abnormal tissue is done. Uh, for example, in venereal warts, precancerous tumors, or to control bleeding, cryosurgery is used. So we just completed this first part of the lecture, which is OBGYN. The second part is short. That's about urology, where we will consider some urological problems for both male and female. Urinalysis. The analysis of urine is the most commonly ordered test, and blood test may also be used to monitor dysfunction of the prostate gland through PSA. I'll talk about the PSA and actually the prostate cancer a little bit more detail later on. Semen analysis and a smear may be obtained to determine fertility. After vasectomy, this is done to confirm absence of sperm cell. Look at this picture here. It's the cystoscopy. An instrument called cystoscope is inserted to examine the wall of the bladder and urethra. Testicular biopsy can be needed, it may be needed from a testicular mass for further lab study. Ectopic pregnancy. In ectopic pregnancy, fertilized egg implants in the uterine tube rather than the uterus. Look at this fertilized egg. It should be moving inside the uterus, but while it stays there and tries to grow, that can be disastrous for both mother and baby. Surgery is needed to remove the embryo prior to rupture of the tube. This condition you see is the endometriosis. Endometrium is the inner lining of the uterus, and if it is displaced, as you see that part of the endometrium is outside the uterus, in fallopian tube, around the ovary, that can be problematic because it will react to the hormonal signals during menstruation every month. So the treatment options are hormonal therapy, endometrial ablation, or leuprolide acetate injections. These can be tried prior to a more extreme measure of total hysterectomy. This one is the fibrocystic breast disease. You see those benign fluid-filled cysts. These are benign, so not a cancer, but it can cause some discomfort and other problems. Treatments include nutrition, hormone compress, analgesics, aspiration, biopsy, and restricted caffeine intake. For the uterine fibroids or leiomyoma, we find benign smooth tumors, okay, for which surgery may be required if causing menstrual difficulties. Now, this one is the ovarian cyst. Cyst is a fluid-filled sac. It can be anywhere, and this time we see it in on ovary. So ovarian cyst can cause some uh, pain, discomfort, menstrual irregularities, also hamper with the um, fertilization. Um, fertility problems of the female. Amenorrhea means absence of menstruation. Dysmenorrhea is the painful menstruation. Now, this conditions coming up is the pelvic support problem. What we see here, we see that the uterus is prolapsing. That means it is going downwards through the vagina. That can be rectocele, cystocele. So when the support system in the pelvic area is lost, that can be discomforting for the patient. Necessary physical therapy, Kegel exercise, or surgery to repair the muscles may be needed. Polyps are the growth with a stem attachment attached to the mucous membrane of the cervix or endometrium. So these are benign conditions. In PMS, patients usually experience swelling, bloating, weight gain, breast tenderness, headache, and mood shifts around the time of menstruation. Vitamins, diuretics may be helpful, and the use of oral contraceptives can help to balance hormonal shifts. Sexual function disorders may cause a woman to lose interest in sexual activity. Counseling to teach relaxation, effective communication, and natural cycle states and responses is often helpful. Uh, Vaginitis, the inflammation of vagina caused by pathogens or chemicals in sprays, douches, or tampons. This is PDD, premenstrual dysphoric disorder. A severe form of PMS, when treatment may include medication, exercise, relaxation techniques, uh, and diet with nutritional modification. In male reproductive system, just above this testicle, you see this epididymis. That organ can be inflamed, and this is the epididymitis. A bacterial infection treated by rest and antibiotic medications. If there is a fluid accumulation inside the scrotum, excessive fluid, that condition is hydrosome. Aspiration of the fluid is needed to relieve discomfort. Impotence is an inability to achieve or maintain erection. Um, it can be physical, it can be psychological. We consider the causes for these conditions. Now, look at this elderly patient. She is experiencing incontinence. Incontinence is loss of bladder control and treatment depending on the cause and severity of the problem. You see, it is difficult to control urination process. Kidney stones are caused by chemical substances in the urine, which forms crystals or stones. May pass spontaneously some of the stones, but may need surgical crushing to assist in the process. They can cause excruciating pain as they travel through the urine. One last video that I want to share with you before I finish this lecture, chapter 39, is to know the prostate cancer. So let's watch this, and after this, this lecture will be completed. Hold on a moment.
The prostate is part of the male reproductive system. It produces prostatic fluid, a component of semen that carries sperm during ejaculation. The urethra, a tube that carries urine from the bladder through the penis and out of the body, passes through the prostate. Prostate tissue is divided into several functional zones: the transition zone, central zone, and peripheral zone. The prostate consists of secretory glands and ducts surrounded by fibromuscular tissue called the stroma. Throughout life, the male sex hormone, testosterone, influences prostate growth and development. Prostatic stromal cells express an enzyme that converts testosterone to dihydrotestosterone. Dihydrotestosterone binds to stromal cells, releasing signaling factors that stimulate prostatic cell division and growth. As men age, dihydrotestosterone can accumulate among prostate cells. In addition, circulating testosterone levels fall and estrogen levels rise. These hormonal changes may lead to excessive prostatic cell growth, characteristic of benign prostatic hyperplasia and prostate cancer. In benign prostatic hyperplasia, the glandular epithelium and stroma proliferate in the transition zone and form nodules that expand the tissue. Over time, the enlarged tissue compresses the urethra and prevents normal urination. In contrast, prostate cancer commonly occurs in the peripheral zone, in which the glandular epithelial cells mutate and divide in an uncontrolled manner. Many new abnormal glands and one or more malignant tumors develop. The large tumors may compress the urethra and disrupt the urine stream. In a process called metastasis, the tumor cells spread to tissues both near and distant from the prostate. Treatment for benign prostatic hyperplasia may include medications such as 5-alpha reductase inhibitors, which block the enzymatic conversion of testosterone to dihydrotestosterone. As a result, the excess stromal and epithelial growth stops and the prostate shrinks. One treatment for prostate cancer is radical prostatectomy, a procedure in which the entire prostate and select surrounding tissues are surgically removed. Other treatments for prostate cancer include chemotherapy, hormone therapy, radiation therapy, and other surgical procedures such as transurethral resection of the prostate or TURP.
Okay, so that is all for chapter 39.